All right, diving in today. Ready for this one?
Absolutely, let's do it.
So, heart attacks, myocardial infarction, big topic.
Yeah, a bit of a heavy one, but super important to get a grip on.
Totally. And we've got some pretty dense material to work through. We're going off the NCBI Bookshelf's Stat Pearls article, and Medscape has a pretty solid overview on MI, too.
Excellent resources, definitely in-depth.
Yeah, so the mission here is to untangle all of that. We want to break it down. How does a heart attack even happen? How do you know if you're having one? What can be done about it? And what are the possible long-term issues? We're cutting through the jargon to get to the real heart of the matter.
I like that. The heart of the matter, literally.
Right. Okay, so let's start with the basics.
Yeah.
What's actually going on in the body when someone has a heart attack?
Okay, so first things first, the core issue is a blockage. You've got blood flow to a part of the heart muscle, the myocardium, and it gets reduced. Sometimes it's even completely cut off.
And that's a problem because,
Well, yeah, because that means the heart muscle isn't getting the oxygen it needs. That's ischemia. Without that oxygen, the heart muscle starts to die.
so it's kind of like if you think of a plant that isn't getting watered.
Exactly. It starts to wilt, right?
Yeah.
Same idea with the heart muscle. It can't function properly without that oxygen.
Okay, that makes sense. So what usually causes this blockage in the first place? What's the main culprit?
Most often, it's coronary artery disease, or CAD. That's the big one.
Right, CAD, we hear about that all the time. But what does it actually look like in the arteries?
So basically, you get this buildup of plaque in the walls of the coronary arteries. And over time, it's like gunk accumulating in a pipe. It narrows the passageway.
Ah, okay, like a clogged drain.
Exactly. And then something triggers this plaque to rupture or erode. And when that happens,
Uh-oh.
the
Yeah.
body tries to fix it, right? Natural response. So it forms a blood clot at the site of the damage.
To try and seal it up.
Right. But that clot can then block the artery completely. And that's when the real trouble starts, because now blood flow is severely restricted, and that part of the heart muscle is in serious trouble.
So it's not just the slow buildup of plaque that's the problem. It's the sudden event where the plaque ruptures and causes a clot.
Exactly. It's a bit like a ticking time bomb. You might have this plaque build up for years, but it's that rupture that really sets off the heart attack.
Wow, okay, so the blood flow is blocked, the heart muscle isn't getting oxygen. What happens next?
Well, if that blockage isn't dealt with quickly, then the heart muscle cells start to die. That's what we call myocardial necrosis. And it's usually not instantaneous. It kind of progresses in stages.
Stages.
Yeah. The inner layer of the heart muscle, the subendocardium, that's the most vulnerable. It gets hit first.
So like the innermost part of the heart?
Right. And then if the blockage isn't relieved, the damage spreads outwards towards the subepicardium, which is the outer layer.
Okay, so it's kind of like a spreading wave of damage.
Exactly. And it's a race against time, because the longer that blockage remains, the more extensive the damage becomes.
So time is muscle, as they say.
Absolutely. Every minute counts.
This is all pretty heavy stuff. You mentioned that the inner layer of the heart muscle is more vulnerable. Why is that?
So the subepicardium, that outer layer, it tends to have better collateral circulation. Think of it like backup routes for blood flow. So it might have a slightly better chance of getting at least some oxygen, even if the main artery is blocked.
Interesting, so it's a bit more resilient.
Exactly.
Yeah.
But that doesn't mean it's invincible. If the blockage persists, the damage will eventually reach the subepicardium as well.
Okay, that makes sense. And what about the long-term effects of this damage? Once those heart muscle cells die, they're gone for good, right?
Unfortunately, yes. The heart isn't very good at regenerating itself. So the damaged area heals by forming scar tissue.
Which isn't ideal, I imagine.
Not really. Scar tissue is strong, but it's not the same as healthy heart muscle. It doesn't contract and pump blood in the same way. So it can definitely affect the overall function of the heart.
Right, because the heart is essentially a pump.
Exactly. And on top of that, you also get this process called remodeling. The surviving heart muscle might stretch or thicken to try and compensate for the damaged area.
Like it's trying to make up for the lost muscle.
Exactly. But over time, that remodeling can actually lead to more problems. It can distort the shape of the heart and affect its efficiency.
Okay, so CAD is the usual suspect in MI, but you mentioned earlier that there are other less common causes as well.
Yeah, there are a few other things that can disrupt blood flow to the heart. Things like vasculitis, where the blood vessels themselves get inflamed.
So that's different from the plaque buildup we were talking about before.
Right. This is an inflammation of the vessel walls, not a blockage within the vessel. You can also have problems with emboli, which are basically traveling blood clots that can get lodged in the coronary arteries.
Ah, okay. So they originate somewhere else in the body and then cause a blockage in the heart.
Exactly. And there are a few other possibilities as well. Things like trauma to the chest, severe coronary artery spasm, certain types of drug use, even some infections.
Wow, it's a longer list than I expected.
Yeah, it's a reminder that the cardiovascular system is pretty complex. There are a lot of things that can go wrong.
Definitely. And speaking of things going wrong, what about silent MIs? What's that all about?
Yeah, silent MIs are a bit tricky. They happen without any of the classic symptoms. So the person might not even realize they've had a heart attack.
So no chest pain, no shortness of breath, nothing.
They might have some very mild symptoms like fatigue or indigestion, but often it's nothing that would make them think, oh, I'm having a heart attack. And that's what makes them so dangerous. The damage is happening without any clear warning signs.
So it's essentially a heart attack that flies under the radar.
Exactly. It might only be picked up later on through routine testing or when the person has other health problems.
Okay, that's pretty scary. And it brings us to diagnosis. How do doctors actually determine if someone is having a heart attack?
Well, the good news is that we have pretty reliable tools for diagnosing MI. It's a combination of looking at the patient's symptoms, their ECG, and their cardiac biomarkers.
Right, so let's break those down one by one. Starting with symptoms, what should people be looking out for?
The hallmark symptom is chest pain, and it's usually not your typical fleeting pain. This is something that lasts for more than 20 minutes.
So not just a quick twinge.
Right. It's usually described as a feeling of pressure, tightness, squeezing, heaviness in the chest. Sometimes it feels like a burning sensation.
And is it always located right in the center of the chest?
It often is, yeah. Kind of behind the breastbone. But the pain can radiate to other areas too,
Yeah.
like the neck, the jaw, the shoulders, and down the arms.
So pain in the left arm, that's a classic sign, right?
Yeah, that's a common one.
Yeah.
But it's important to remember that the pain can radiate to the right arm as well. It's not always just on the left side.
Okay, good to know. And are there any other symptoms that might accompany the chest pain?
Definitely. Shortness of breath, feeling really fatigued, nauseous, sweating profusely, even a sense of impending doom. These are all things that can happen during a heart attack.
Wow, that's a pretty intense experience. And are those symptoms always present in every case?
Not necessarily. Some people, especially women, older adults, and people with diabetes, they might have atypical symptoms, like just feeling really tired or having some indigestion.
So it's not always the dramatic clutching your chest scenario we see in the movies.
Right. Sometimes it can be much more subtle, and that's why it's so important to be aware of any unusual symptoms and to get checked out by a doctor if you're concerned.
Okay, so symptoms are one piece of the puzzle. But what about the ECG? How does that help in the diagnosis?
The ECG is crucial. It gives us a real-time look at the electrical activity of the heart. And during a heart attack, we often see specific changes in the ECG pattern.
Like what kinds of changes?
One of the key signs is ST segment elevation. It basically means that a portion of the ECG tracing is higher than it should be. And it usually indicates that there's an active blockage in a coronary artery.
So the ECG can actually pinpoint where the problem is.
To a certain extent, yes.
Yeah.
It can tell us which area of the heart is being affected.
That's incredible.
There are other ECG changes that can be indicative of a heart attack too. Things like ST segment depression or T-wave inversion. But the ST elevation, that's usually the most dramatic and concerning finding.
And what about heart attacks that have happened in the past? Can the ECG reveal those as well?
Sometimes, yes. There might be certain patterns on the ECG that suggest a previous heart attack, even if the person didn't have any noticeable symptoms at the time.
Wow, so the ECG is like a historical record of the heart's activity.
In a way, yes. It can provide valuable clues about past events as well as current problems.
Okay, so we've got symptoms and ECG findings. What about the cardiac biomarkers? What are those all about?
So biomarkers are basically substances that are released into the bloodstream when there's damage to the heart muscle. And we can measure those levels with a blood test.
So if there's a spike in these biomarkers, that means there's been a heart attack.
It's a strong indication, yes. The most sensitive and specific biomarkers for MI are the cardiac troponins.
Troponins.
Yeah. Troponin I and troponin T. They're proteins that are found in heart muscle cells. And when those cells are damaged, troponin is released into the bloodstream.
Okay, so the higher the troponin level, the more extensive the damage.
Generally speaking, yes.
Yeah.
And we usually check troponin levels at several different time points to see how they're trending. That gives us more information about the severity and the timing of the heart attack.
Got it. So it's not just a single snapshot. It's about looking at the pattern over time.
Exactly. And then there are other cardiac biomarkers that can be measured as well, like creatine kinase MB or CKMB. But troponin is the gold standard. It's the most reliable indicator of heart muscle damage.
Okay, so we've got symptoms, ECG, biomarkers. Is that pretty much all that's needed for a diagnosis?
Usually, yes. But sometimes we might also use imaging tests to get a more detailed look at the heart. Things like echocardiography, which is an ultrasound of the heart.
So that can actually show the damage to the heart muscle.
It can show us if there are any areas of the heart that aren't contracting properly, which could be a sign of reduced blood flow. We might also do a cardiac MRI, which gives us even more detailed images of the heart's structure and function.
Okay, so imaging is kind of like the icing on the cake.
In a way, yes. It helps us to confirm the diagnosis and to assess the extent of the damage.
All right, so let's say someone is diagnosed with a heart attack. What happens next? What's the immediate course of action?
The absolute priority is to restore blood flow to the blocked artery as quickly as possible. And there are two main ways to do that. PCI, which stands for percutaneous coronary intervention, and fibrinolysis, which involves using medications to dissolve the clot.
So PCI, that's the one where they insert a catheter and open up the blockage.
Exactly. It's also often called angioplasty. They thread a thin tube through a blood vessel, usually in the groin or the wrist, and guide it up to the blocked coronary artery. Then they inflate a tiny balloon at the tip of the catheter to open up the blockage.
And is that usually a permanent fix?
Often, they'll also insert a stent, which is a small metal mesh tube, to help keep the artery open. That reduces the chances of it getting blocked again.
Okay, that makes sense. But what about fibrinolysis? How does that work?
Fibrinolysis uses medications called thrombolytic agents to dissolve the blood clot. So it's like breaking up the blockage from within.
Interesting. So why wouldn't you always use PCI? It seems like a more direct approach.
It is, but PCI requires a specialized cardiac catheterization lab and a team of experienced interventional cardiologists. So not every hospital has the capability to do it.
I see. So fibrinolysis is kind of like a backup option if PCI isn't available.
Exactly. Or if there's a significant delay in getting the patient to a PCI-capable facility. Time is muscle, remember, so we need to act quickly.
Absolutely. So PCI or fibrinolysis, those are the main ways to restore blood flow. But what about managing the other symptoms of a heart attack, like the pain and the anxiety?
Right, those are important considerations too. For pain relief, we often use intravenous opioids, like morphine.
Morphine, that's pretty strong stuff.
It is. But the pain of a heart attack can be really severe, so we need something powerful to manage it.
Okay, that makes sense. And what about the anxiety? I imagine that would be pretty overwhelming too.
Definitely. We might use a mild sedative to help calm the patient down, and supplemental oxygen is almost always given to make sure the heart is getting as much oxygen as possible.
Okay, that all sounds pretty standard. What about those other medications we often hear about in connection with heart attacks, like nitrates and beta blockers?
Yeah, those are important too. Nitrates, like nitroglycerin, they help to dilate the blood vessels, which can improve blood flow to the heart. Beta blockers, on the other hand, they work by slowing down the heart rate and lowering blood pressure.
So they reduce the workload on the heart?
Exactly. And that can help to minimize further damage to the heart muscle.
Okay, makes sense. And then there's aspirin, right?
Right. Aspirin is a must for anyone having a heart attack. It helps to prevent further clotting.
So it's like a first-line defense against more blockages.
Exactly. And we usually give a loading dose of aspirin right away, followed by a daily low-dose aspirin for long-term prevention.
So aspirin is kind of a wonder drug in this situation.
It's definitely a cornerstone of heart attack treatment. And there are other antiplatelet medications that we might use as well, especially if the patient has had a PCI.
Okay, so lots of medications involved in the acute management of a heart attack. What about the long-term picture? What does recovery and management look like after the initial event?
Well, the goal of long-term management is to prevent another heart attack from happening.
Yeah.
And that involves a combination of medication, lifestyle changes, and regular monitoring.
So it's a pretty comprehensive approach.
It has to be. We want to address all the risk factors that could contribute to another cardiac event. So medications like statins to lower cholesterol, ACE inhibitors to lower blood pressure, and beta blockers to control heart rate and rhythm are often prescribed.
So it's kind of like a multi-pronged attack on heart disease.
Exactly. And then lifestyle changes are absolutely crucial as well. Quitting smoking, eating a healthy diet, getting regular exercise, managing stress. All of these things play a role in reducing the risk of future problems.
So it's not just about taking a pill, it's about making real changes to your lifestyle.
Absolutely. And those changes can make a huge difference in the long run.
Okay, that makes sense. But even with the best treatment and management, there's always a chance of complications, right?
Unfortunately, yes. There are a number of things that can happen after a heart attack.
Like what kinds of things?
Well, one possibility is reinfarction, which basically means having another heart attack. That's always a concern.
Oh, wow.
And the initial heart attack can sometimes lead to other problems as well, like heart failure, where the heart isn't pumping blood efficiently.
So that's a direct result of the damage to the heart muscle.
Right. And then there are arrhythmias, which are abnormal heart rhythms. Those can be pretty serious too.
Arrhythmias.
Yeah. It basically means that the electrical signals that control the heartbeat are disrupted. And that can lead to a variety of problems, from a racing heart to a dangerously slow heart rate.
Okay, that doesn't sound good. Are there any other complications we should be aware of?
There are. Another possibility is cardiac rupture, which is a tear in the heart wall. That's a very serious complication. And then there's the risk of blood clots forming in the heart, which can then travel to other parts of the body and cause problems like stroke.
Wow, so there's a lot that can go wrong even after the initial heart attack has been treated.
That's why ongoing monitoring and management are so important. We want to catch any potential problems early on and intervene as quickly as possible.
Okay, that makes sense. So what about the overall prognosis for someone who's had a heart attack?
Well, the good news is that the survival rates for heart attack have improved significantly over the years,
That's encouraging.
but it's still a serious condition. And the prognosis really depends on a number of factors, like the extent of the damage to the heart muscle, the person's overall health, and how quickly they receive treatment.
So early intervention is key.
Absolutely. The sooner we can restore blood flow to the heart, the better the chances of a good outcome.
Okay, that's a powerful message. And on that note, let's wrap up this deep dive. We've covered a lot of ground today.
We have. It's a complex topic, but hopefully we've managed to shed some light on the key aspects of myocardial infarction.
I think so. We've talked about the underlying causes, the typical symptoms, the diagnostic process, the immediate and long-term management strategies, and the potential complications. It's a lot to take in, but it's all essential information for understanding this critical condition.
Absolutely. And I think it's important to remember that heart attacks are often preventable. So much of it comes down to lifestyle choices.
Right, and that's a good reminder for all of us. Thanks for joining us for this deep dive into the world of myocardial infarction. I hope you found it informative and helpful. Now consider this. Knowing what we know about the significant impact of lifestyle choices on our cardiovascular health, what small but meaningful changes can we incorporate into our daily routines to tilt the scales in favor of a healthier heart? It's food for thought and hopefully a spark for positive action.
Well said.